attempt for work-life balance, have time for yourself. Even if it is money that you are interested, and there's nothing wrong in being interested in money.
Yes.
Any of the specialties has got the potential to make money. He was more relieved than me.
Moment, like
so she told me in Luo what it amounts to.
yes.
My son, you speak Luo. Why have you been torturing me for?
Okay.
Welcome to Daktari Tone, where voices, perspectives, and sounds relating to healthcare practitioners and matters health are amplified. This is a podcast by Daktari Online, created for healthcare professionals across Kenya. Each episode brings you honest conversations, expert insights, and real-life stories from the front lines of care.
So, you had mentioned earlier that when you were getting into medical school, it was more of a calling or something called you to internal medicine, and then later now you went ahead now to specialize in cardiology.
Yeah.
So what advice would you give to young medics out there? How do they with what happened to you, how do you really know that cardiology is my thing?
Yeah, my advice to young medics is interestingly, there is a sort of lecture we give to the students who come for internal medicine, but of course this comes after they come into the department. That is specifically in the University of Nairobi where I work. And maybe we need to give it a lot earlier. But the point I'm making is that when you're getting into these specialties, you're getting in as a young person. So you have a lot of years ahead.
Yes.
And medicine is, of course, hard work. And I usually say that get into something that you do not only have the talent for, but you also have a passion for. Because it helps lessen the stress, if you like, because you're doing something that I've had people say that I'm very happy with my employer because he's paying me for something I would do for free. So you're doing something that you have a true passion for. And the reason that I'm saying that is very often, and I know this because I've been training young doctors for the last 40 years or so. Sometimes specialty training considerations become like, which is the profession where I can make the most money easily. My advice to any of the young guys there is that even if it is money that you are interested, and there's nothing wrong in being interested in money.
Yes.
Any of the specialties has got the potential to make money. So do something that, one, you have an aptitude for. There are probably people who are just not wired to be surgeons. And there are people who are not wired to be obstetricians. There are people who are not wired to be internists. The surgeons, for example, say what we do as internists, so that's our broader specialty, is too much talking and too little action. While we tell the surgeons that they use too much of their hands and too little of their brains. Of course, none of that is true, but it just shows that there's different specialties. There are nuances that make one more suitable for the other. So it is a question, is that really what you want to spend your life doing? Both in terms of your natural abilities, what do you do best, but also what really interests you. So I think that's absolutely important. I think an emerging thing, this is probably not part of your question, but an emerging thing that arises out of the fact that you are in here for the long haul it's the whole issue of, work-life balance. Yeah, I mean, we're having a lot of issues of mental health issues in young professionals, issues of burnout and all that. Yes, work is important, but you really can't do that work unless you're healthy yourself. So the whole issue of work-life balance. So that those are the things that I would tell a young person getting into the profession. It is hard work, but it has been done before, so there is nothing really unique about that. And I suppose every profession you go to has got their own challenges. So that's what I would say.
Okay, so as you've heard from Dr. Ogolla, have a passion for what you're going for, so that it makes it easier for you to handle what you're choosing when it comes to your social life, it comes to what gives you money. As much as, yes, it shouldn't be the only reason why you're going for something, because you're like, yeah, this specialty will make me earn more money, but you should also go for something that you love. With his own words, you have an aptitude for. Yes. And yes, we'll still further ahead talk about work-life balance and mental health, how you handled that for your many years in cardiology. But right now, I'd like first to get to understand more on your, professional wisdom. So what is the most critical lessons that you've learned in your practice?
One, that be patient. Patience pays. Having said that, by nature, I'm not a very patient person.
Okay.
But I've learned to be patient. Be persistent. Especially when you are dealing with broader issues beyond the individual patient. Especially in public institutions. Sometimes the barriers are insurmountable, but you work at them, it works. Be collaborative, be a team player. You could never ever do it alone. And in terms of being a team player, being a team really means being a team, which means cadres at various levels. So the rest of your team is extremely important in getting to achieve your aim, which in a clinical sense is your patient outcome.
Yes.
In a broader sense is health of the population. So working with a team, recognizing and respecting the team. I'll stop mentioning the numbers because I don't know whether I've reached 4 or 5 or 6.
Okay.
Is that your actions and your decisions should, in the clinical sense now, should always be patient-centered. That you have the knowledge, the technical competence, but the person you're dealing with is the patient, and that patient preferences, patient autonomy must be respected. It is absolutely important. It is not our role to impose decisions. It is our role to guide, to advise, to help, but help the patients make the decision themselves. And then, yes, like we said, attempt for work-life balance. Have time for yourself. Having said that, I'm not sure that I did it very well, but I've survived. I'm here.
Yes.
And if my children will be watching this sometime, they'll tell me whether these things I say apply to me or not. But yes, you have a life, you have a family, and of course that family is really your rock, is where you go back to. And then maybe finally is what I would call always have a societal consciousness that it is important that the society impacts everything you do.
Yes.
And two, as a learned member of the society, you have an obligation to be part and parcel of what goes on in your society. One of the things that I remember most, I've worked very much with the ministry, that especially the non-communicable diseases, and one of the doctors who used to work there, he said something that really struck me, that you guys, you're sitting here, you don't even know you are MCAs. That you know that your MCA probably has got more impact on the healthcare in the village where you come from than anybody else. So yeah, that societal consciousness that healthcare does not exist in isolation. It exists as part of the broader society. It contributes to that society. It is impacted by that society. Yeah.
Okay.
I think those are many things.
Yes. Let me just bring it to very few words. So one thing that I'm getting so much from you that I feel like life has also pushed you to that advice more is work-life balance. And as much as yes, you say that maybe in your past you didn't really look into it that much. Right now, is the case still the same?
No, absolutely. Things evolve, and the stresses of society are different, and these things evolve, and there were probably things that we had to endure in my generation that we don't have to make the current generation endure.
Yes. Okay. Yes. So why I asked that question is because it's never too late to learn something and relearn something.
Absolutely.
So as much as yes, at that time it wasn't something that you really doing it for your family, the moment you realize it and come into a realization, because sometimes you get so lost into something, and because one thing again I'm picking from this is that you're passionate about your work. Even with the very many caps that you did mention, it really shows that you're really passionate. And now the advice that you've given that I've picked is patience, persistence, and a collaborator, being a team player. And this has cut across.
And also thinking about the patient.
Yes, thinking about the patient
and the society.
Yes. Thank you. Yes, and yes, it's true. The healthcare also it's not a standalone, facility. There's many channels that can affect it, or it being an effect of, and that's a really great insight. So, this is to even things out. If you can remember your first patient with a heart condition.
Let me try to.
I know it must be many years back.
Okay, so I'll tell you this because that's got an amusing angle to it.
Okay.
So, in our medical school structure, we have, you first begin to see patients, what we call clinical rotation, in third year at that time, because we had a 5-year program. So you first 2 years is sort of the basic sciences. You start the clinical rotation in third year. So I'm doing my first clinical exam in third year. By coincidence, it happened to be somebody with heart disease. This is 1976. I remember it like it was yesterday. So there's this lady who was from Busia. And you probably know that, there's a lot of interaction across the border. So Busia is sort of the Luya border.
Yeah.
So this lady had in quotes a Luo name, but she was from Busia, and from her accent I could clearly get that she was Luya. So you have 1 hour you are given 1 hour with the patient. Take the whole history, examine and all that before your examiners come and to examine you. And I can tell you, those days, our teachers were very intimidating characters. So 15 minutes go, and we are struggling, both of us, with Kiswahili. Completely, I'm not making any headway. So I just tried, let me see if you could speak Luo, because we were not making any headway.
Yes.
And she was more relieved than me.
Like, aha moment, like.
So she told me in Luo what it amounts to.
Yes.
My son, you speak Luo, why have you been torturing me for?
Okay.
So that I remember. I think that was
Yes, that must be a memorable moment.
Because here she was feeling tortured, and me feeling I'm going to fail because I'm not making any headway with my session.
That's interesting. So for like a long time, you're struggling with Kiswahili, trying to understand. I can imagine medical terms in Swahili.
Yes.
Hey, I literally call everything in kuumwa na kichwa. I'll just say naumwa na kichwa. But yeah, that's memorable. When you started speaking Luo and you're like hopeful, like I really hope she understands this.
Yeah.
And then it just becomes much better, and for you even the examination, at least I'm sure you passed.
Everything went smoothly after that.
And have you ever had to treat a relative or a close friend?
Yeah. Close friends, many. Some whom I wish I didn't have to treat, but they insist that they can't go to anybody else. Relatives, sort of yes or no. I mean, there are many things that your relatives will come to you, and there are easier things. There are things that are you can do without getting too. But I try to get my relatives to see my colleagues. Of course, the problem is that being a doctor in the family, and I was the first doctor in my family, and I was the only doctor for a long time. Of course, whether it is within Nairobi or you go to the village, everything comes to you. So you have to handle it.
Okay.
I mean, you're not going to tell your auntie in the village that, hey, that one, it is your knee, that is an orthopedic problem. I'm a cardiologist. They don't know those things.
Yeah,
you're a doctor. You're a doctor.
You know everything.
You have to do it. Yeah.
Yes. So how do you maintain clinical sharpness and empathy under pressure?
Sorry, let me get that right. Do you mean maintaining clinical competence? Because you sort of alluded to two different things.
Yes.
Of course, clinical competence, that's a big issue because, I mean, the medical field, keeps evolving very rapidly, very rapidly. So you have to keep sharp. And that's why, we have our regulatory authorities insisting on, recertification by, sort of demonstrating that you participated in what we call continuous medical education. Of course, me being at the level of a teacher and a researcher, I go beyond that. So, I mean, it's a question of making sure that you continue to read. The medical literature is quite out there. And I suppose one of the beauties of, in a sense, of being a teacher is that by default, you have to keep reading because as you would appreciate, most people who come to medical school are very brilliant guys. So if you are not on your toes, these brilliant guys will bring you down to earth. So so it is just a question of making sure that, and one of the concepts in medical practice now is what we call self-directed learning, which means, you get through college, you become a practitioner. You are an adult on your own. So it is your responsibility. I mean, there are guides on how to do it, but it is your responsibility on self-directed learning. The other issue you touch, which is really different, is empathy. And I think that's was sort of covered by what I said. I think it's the consciousness that
patients' needs are different.
Yes, they are different, and that you are dealing with an individual, and individuals are different. You are not treating heart failure or treating malaria.
Yes.
Or treating HIV, you are treating a human being
They're treating
malaria.
with malaria.
With malaria, and having that consciousness, and like I said, appreciating the patient's point of view, and recognizing that this patient, as much as they are important, is really part of a family and of a society, and all those things come in. I mean, if I'm going to say you need an oxygen concentrator, and you're going back to a slum that doesn't have electricity, how are you going to get that oxygen concentrator, for example? If I'm going to give you this medicine, which is beyond your financial capability. And so all those things, social, emotional, psychological, financial, all have to get into the decision making.
That's it for this episode, and I hope you stick around so that we can get more insights from Dr. Ogolla, who is going to tell us how he manages to be in this high pressure, career, and also talk more on innovations and policies. See you next.